Hi everyone, in this video, Lindsay, our trainer, is going to demonstrate high quality CPR. Now, the Australian Resuscitation Council say that any CPR is better than none, right?
That's right.
However, as healthcare practitioners, we want to give the highest quality CPR we can to give our patients, the best outcome possible. So, Lindsay, can you run us through high quality CPR protocol?
So, first off, we want to have our hands positioned in a lower half of the sternum here, about here. From there, we're looking at a compression rate of approximately 100 to 120 beats per minute. We also want to try and compress a third of the depth of the chest, but we really need to make sure we get adequate recoil, as in coming off the chest and not leaning on our patient. And that's just to make sure that the heart fills up with enough blood. That looks a little something like this. That click on these little annies means that I'm going a third of the depth of the chest, and I'm making sure that I'm coming up off the chest and not leaning on my patient. Okay?
Excellent.
From there, we want to consider a compression to ventilation ratio of approximately 30 compressions to 2 ventilations. Our ventilation should be approximately 1 second per ventilation. Yeah? We might want to consider the use of a metronome, and then we also would like to count up from 20 as we're approaching that 30 to let our partner know that it's almost time for them to ventilate. We really need to consider swapping compressors after approximately 2 minutes. That's to make sure that we don't tire ourselves, because CPR can be pretty exhausting. And when you're tired, you're not getting good quality CPR.
Yeah.
We really need to make sure that we're minimizing time off chest. So when we're swapping, it's a good idea to do that while our AED is analyzing the rhythm of the patient. Okay. And as soon as that shock is in, we want to make sure that we're jumping back on chest to doing good quality CPR again.
All right, so that's for an adult patient. How does it differ for a child or an infant?
Well, I'll show you. So fundamentally, our CPR is the same. Okay. Same rate, same depth, adequate recoil, same compression ratio. The main difference with children is we want to use a one-hand technique, like so. If we find that a bit too tiring or having a bit of trouble balancing, we can brace by holding onto our arm or our wrist, but it's still just one hand. If we have a larger child, starting to look more like the size of an adult, we might consider using our two-hand technique because they've got a very similar chest.
Awesome. Now for an infant?
For an infant, generally we consider them as 12 months or less. We use a 2-finger technique. Now there's 2 main ways of doing this. One is just 2 fingers on the chest, like so. The other main way is we actually cradle the back and then we use our thumbs as our 2 fingers. Once again, ensuring that we're keeping up good quality CPR by following the steps that I addressed earlier.
Awesome, that was fantastic. Thanks, Lindsay, really clear. That is high quality CPR. Now, remember that CPR is just buying time for this patient. We're moving oxygenated blood to keep those organs viable. We also need a defibrillator. We need to organise defibrillation as soon as possible to give this patient the best chance of surviving. Thanks, Lindsay.